So welcome everyone. My name is Felice Stonestrom and I manage the community programs here at Packard Children's Hospital. And it's my great pleasure to introduce our speaker tonight. Before we get started though, I just want to remind everyone that we are videotaping this lecture. So we ask that you hold all your questions until the end, at which point we'll turn off the cameras and then you can ask questions anonymously. So our lecture tonight is entitled Lactation and Employment, Making It Work. Susan Crow is a clinical associate professor of obstetrics and gynecology at the Stanford University School of Medicine. She's been on faculty here since 1998. She sees obstetric clinic patients and delivers babies at Lucille Packard Children's Hospital, Stanford, where she teaches medical students and residents as well. She co-leads local improvement teams on labor and delivery in the maternity units, where she has joined nursing leadership and performance improvement leaders to make changes in the hospital that enable skin-to-skin for mothers and babies after vaginal and cesarean birth deliveries. She serves on the board of directors of the California Breastfeeding Coalition and the San Jose Mother's Milk Bank. So please join me in welcoming Dr. Crow to our speaker.
Good evening, and thank you all for being here, and I'm very appreciative of this invitation to talk on one of my very favorite topics. And I'm just this is an overview of the topics we'll be covering tonight. We'll talk about general breastfeeding recommendations and why we're here. We'll talk about breastfeeding basics in the first few weeks and how to get off. I'll spend a little time talking about how to get off to a good start so that you can continue breastfeeding after you return to work. A little bit about pumps and pumping basics, and then how to prepare about 2 to 4 weeks before you return to work. And that can vary widely amongst different maternity leaves. I'm also going to talk briefly about the Affordable Care Act, lactation accommodation in California, and paid family leave, and then of course when you go back to work. I'm going to give you a little bit of background on why I initially became interested in this. On the left there you'll see my firstborn. Her name is Laura. She was born during my residency training in my chief year of obstetrics and gynecology. I actually had no intention of breastfeeding. She's 18 years old this November. And then that wasn't something that was expected or really accommodated due to her intolerance of the formula and some frantic relactating during my 5.5-week maternity leave. I then went back to work, and in spite of working 100+ hours a week, I was able to successfully, exclusively breastfeed her with the support of a few nurses and a few other people at that time. On the right is Mary, and she is now 15, and she came at a different time in my life. I was studying for boards and was able to work 1 day a week up until she was 6 months old, and that experience was completely different. I gave her the bottle once a week and forgot to give her the bottle 1 week, and she never took it again when she was 12 weeks old. So I learned different things. I didn't want to pump all the time like I had with my first, but that ended up having some problems of its own, as you can imagine. On the left are the two of them together, and on the right is Mary holding Peter, who's now 10 years old. And so there was a big gap in ages, and I had completely different work experiences as I experienced lactation and employment. So I'm first going to talk about why we're here, what is the recommendation, and why we hope for you to be able to continue. So breastfeeding is recommended exclusively for about 6 months, followed by continued breastfeeding with complementary foods for 1 year or longer as mutually desired by mother and infant. And this is from our American Academy of Pediatrics and our organizations of obstetrics and gynecologists and family practice. So this is widely viewed as the optimal way to feed your baby. It's healthy for baby. I could speak for a whole hour on why and all the wonderful health benefits for the babies. So their decreased risk of infections, colds, intestinal illnesses, hospitalization, and there's even long-term benefits with reduction of different problems, obesity, diabetes, and improved developmental outcomes. These are things that are, as you breastfeed longer and are able to continue breastfeeding during that first year, they increase in benefit. Healthy for the mom, reducing risks of breast cancer, ovarian cancer, type 2 diabetes, heart disease, and also it's a special bonding opportunity. As you breastfeed your baby, your body releases hormones that will give you a sense of peace and bonding with your baby. It's also good for society and the environment. In healthcare, you know, these are large expenses for us, and if 90% of U.S. mothers breastfed, billions of dollars could be saved in healthcare costs. And it's environmentally friendly. You don't have to, there's a lot of environmental savings as well. So I like this graph. It shows basically that the rates on top are of any breastfeeding, and the rate below is of exclusive breastfeeding. And these numbers are actually a little bit better than they were when this graph was made in 2011. But you can see here on the bottom that as people return to work, that there can be more challenges in exclusive breast milk feeding, and mothers, as you all are here, it sounds you're likely planning to return to the workplace. In this picture here is actually one of my colleagues at another hospital who was at a meeting, and she had to be at the meeting, and you wouldn't know, but she's expressing milk for her newborn there. 57.3% of women with babies under the age of 12 months are employed. So, and often employed at 12 weeks or even less postpartum. So this is an important issue to figure out how we can do this at work. Women who do enter the workforce and want to continue to breastfeed, they do have specific needs, and back when I thought maybe you could just breastfeed in the morning and breastfeed at night, and then that would be fine. Unfortunately, or fortunately, the body isn't really made that way, and so there is a need to express breast milk during the day. I'm going to give you a couple of basic, kind of 4 basic points, and not spend a large time on this, but especially as many of you listening haven't yet delivered, I want a few points to be made about we often want to prepare for our return to work as soon as we deliver. And there is a transition phase where you'll be establishing breastfeeding. I'm going to encourage you to try and not think about that, and try and really think and stay focused on and present with your baby now. When your baby is born with extra fluid on board and an extra type of fat that will break down and turn into heat and water. So your baby doesn't need a lot of volume, and I want you to really trust that the colostrum that your body will make at delivery is just what your baby needs and just the amount that your baby needs. The baby's tummy is less than an ounce in size at delivery, and so when you see, you may notice that the amount of colostrum or the initial breast milk that your baby is taking in is really small in volume, and your baby will lose weight. Your baby was designed to do that, and that is okay, and you can be in touch with your pediatrician. There can be extenuating circumstances, but by and large, this is what your baby was meant to do. And then number 2, look at the latch and make sure that the latch is good. The baby's mouth should be deep over a lot of the, not just the nipple, but the surrounding part of the nipple. And that the initial latch, you may feel some pressure with that. That may be a little bit uncomfortable, but it should not hurt throughout the feed. And if it does, make sure you see a professional. And here, there's a lot of good websites online, but make sure you see a professional to actually look at the latch and make sure that it doesn't hurt. Because also, if baby's not deeply latched on, baby won't be able to stimulate your milk supply to be produced. The other thing is to really pay attention. Frequent feeding is the norm. And so feed whenever your baby shows signs of hunger in those initial weeks. And this baby has the hand in the mouth, and that is a sign of hunger. This baby isn't crying. This baby is just sucking on a fist. And so encourage you to really talk to your maternity nurses when you deliver, and also lactation specialists to learn how to pick up on early signs of hunger, so that that you would know that crying in the breastfed baby is usually a late sign of hunger. And spend time skin to skin with your baby. So these are, and baby wearing. When you're first getting started with breastfeeding, these are things that can be of enormous benefit to you and your baby. And then a few more points for the first few weeks. Enjoy that perfect supply demand, and resist the urge to start building up your freezer supply in those first few weeks. We live in a society where more is better, and we just want more, and we see that freezer supply grow. But what's really perfect about breastfeeding is that if you're feeding directly at the breast, your body and your baby will be able to figure out exactly the supply and demand. And for example, if you're in a very hot place, your baby doesn't need to take a bottle of water. Your breast milk will be more watery for that baby if you feed the baby when it shows signs of hunger. So it's just an amazing, and then at the end of a feed, your baby will get more high fat content at the end of a feed. And all of these things are perfectly made, and just really encourage you to trust your body through this time and resist the urge. And there is no need to get used to formula. If you do choose or need to introduce formula, the later the better, and the more likely your baby will tolerate it. I'm going to give you a few tips on pumps and pumping basics. I'm trying very hard to remain commercial unbiased here. There are a lot of good pumps out there, and I encourage you, we can talk about this a little bit after, but I encourage you to not be necessarily fixated on one pump, and if your insurance company doesn't cover it, that you won't be able to breastfeed. There's a lot of good pumps out there and good companies making them. I am going to show you 3 books that I think are very helpful. Working Without Weaning is a book that has a lot of good practical tips, and it's very, there's a lot in there. It's not just about when you go back to work. There's a lot about breastfeeding initiation, and it's a little bit older than the other books I'll talk about, but it's got some great basic tips. The Nursing Mother's Companion, and I should also say The Womanly Art of Breastfeeding from the Lactation League. Both of these books are great. They include some things on back to work. The Nursing Mother's Companion has a lot about pumps, and you can get more details about pumps from that. And this is a newer book as I was preparing for this talk that I came across. And the author, this just came out in September. I want to thank the author. She's allowed me to use some slides that I hope you all find a little bit funny later in the talk. She approaches it with a very common sense approach and has been through the ringer. She's traveled across the world and had to pump in the back of Jeeps, and she's got a really positive attitude, and I enjoy her book quite a bit. It's a very easy to read book. I don't agree with 100% of what's said in any of these books, as you won't. You'll find what works best for you from all of these sources. So now I'm going to talk a little bit about when do I introduce the bottle. I talked to you a little already about some of the downfalls of not giving the bottle enough. It can be very difficult if your baby does not take the bottle. That being said, once your baby has learned to nurse well, somewhere between 2 and 4 months, I recommend that you introduce the bottle. Even one bottle for some babies can be very confusing initially. Other babies, it's not so confusing, but you don't really know what you've got until you try it. I don't recommend waiting until you're 6 weeks into things, even though breastfeeding is still in the process of getting the supply-demand worked out. Some babies, you'll need to work quite a bit harder at getting a 6-week-old baby to take the bottle. At that point, I do recommend that you feed your baby at least once a week. Some people have recommended that you do it daily, and I worry about that because that means during your precious maternity leave, you're getting that pump out every day. You will have ample opportunity for your baby to get the bottle and more than ample opportunity to use the breast pump. So I encourage you to wait on those things as long as you can. And once a week, I think, is adequate for most babies. If you do it once a week and you notice that your baby suddenly is having a much harder time with it, I would do it daily until it gets easy and then spread it out maybe to twice a week. So keeping that in mind. And then how do you choose a pump? So your insurance companies will offer you a selection of breast pumps, and to my knowledge in this area, they are offering a double electric pump to all of the patients in this area. And even our patients who are on Medi-Cal or on the version of Medicaid in my area are able to get kind of watered down versions of very good breast pumps. They might not have the fancy case, but they get the pump. When you're thinking about getting a pump, you also want to think about, do I need a hospital grade pump versus a single user pump? Most of the pumps on the market, most of them are going to be single user pumps. Hospital grade pumps, people can use it differently. The term actually means that you can use it amongst different people. It doesn't mean a whole lot more than that. Some of the brands who make hospital grade pumps do make a more efficient and gentler hospital grade pump than is their single user tote around milk pump, breast pump. So something to think about. And also consider a pump that has a car battery adapter or an option for a battery pack. You may be where you don't have a source of electricity, and think about your own work situation and see if you might find that useful. Hand pumps are great to have in an emergency if you need to use occasionally. They sometimes will take people longer, and not often for women who are working full-time. They don't tend to be the only pump they need. There are companies who make mobile pumps and who can attach the pump to themselves, and there are also companies who make milk collection devices that they can put inside their nursing bra and allow them to be on the go while they pump their milk. So these are things just to know that they're out there. And if you are in a situation, this was developed by an emergency room physician who could not stop seeing patients and was determined to make milk for her baby. And she was able to design this collection system where she could go about seeing her patients while this battery-operated pump noise was going on in the background. So anyway, there's a lot of options, and I just want you to know that if that's something that you need for your particular work situation. So do I really need to pump when I go back to work? And the answer depends. And at this point, I just want to highlight, I am giving this talk to you as though you want to breastfeed exclusively for 6 months and continue for a year. If your goal is different, I want you to know that that is okay, and that you should congratulate yourself for any breast milk you are able to provide your baby. And some of this advice that I'm going to give that follows, you'll need to adapt to your situation and your goals. So I just want to put that out there. And I also want to let you know that people can do this, but I want to put that out there, that you may need to modify this if your goals are different. So how do you get started? So you're 2 to 4 weeks, baby's latching very well, and the latch is going great. You're ready to introduce the bottle. I'd really strongly recommend that you do that with your own breast milk. And pumping you want to pump maybe halfway between a feeding. Well, that can be hard, because once you have a baby, you may see that your baby feeds pretty frequently, but trying to pump maybe a half an hour or hour after a morning feed. There's a lot more prolactin in your system, which is a hormone that helps you with breastfeeding in the morning. And so that can be a good time to express milk and see some results with that. You want to make sure your kit is set up correctly. That can be the most challenging part about pumping, is making sure if one filter is not there, it won't work, and making sure it's set up. And then pump right into a bottle, and then use that bottle for the feed when your baby then wants to eat. Choosing a bottle, and I'll talk a little bit about this with a slow flow nipple, is very important. You want it to be as similar as possible to breastfeeding. So there's no need to refrigerate the milk or heat it up. You can just leave it in the bottle, shake it up a little and gently, and then give it to baby when baby is hungry. And then I want to talk briefly about how do you feed with the bottle. The breastfed baby has to work to get its milk, and the bottle-fed baby works a little bit less. And if you tip a bottle over, it will drip out milk. And the breast doesn't, after the initial adjustment phases, does not do that. So what we want is, and these are some websites here that Kelly Mom is also is a great website as far as teaching you how to do what we call paced feeds. But I'm going to tell you a little bit myself right now. So use a slow flow nipple. Put an ounce or two into a bottle. You don't want to put a lot more than that because your baby is probably not taking large volumes of milk at 2 to 4 weeks postpartum, and so you're not going to want to throw it away. You've worked really hard for this milk, so just put a little bit in the bottle, and then sit the baby upright so that the goal here is to minimize the effects of gravity and to make it as much work for your baby to get the milk as closely mimicking breastfeeding as possible. Placing the nipple in the baby when the baby's mouth opens wide and trying to mimic breastfeeding in that way. And then keeping the bottle horizontal. And you can see that here, this baby's not doing this. The baby is horizontal, minimizing the effects of gravity. And keeping the bottle tilted only enough so that the baby's not taking in just air. And don't force your baby to finish the bottle. So now I'm going to talk about what to do depending on your length of maternity leave. This may be a very short interval. You may be going back at 6 weeks. So just after introducing the bottle, you may want to start preparing. If you have 3 months, 6 months, longer maternity leave, then I'm going to encourage you to not pump and fill your freezer prior to it with more than a few weeks before you return to work. 2 to 4 weeks will be plenty for you to do what you need to prepare for returning to work. The biggest part of breastfeeding when you return to work is really focusing on that 4 to 6 weeks of establishing breastfeeding. So a few weeks before you return to work, start pumping once a day and store that milk. And what will happen is your body will be triggered to make a little bit more milk. So if you pump maybe in half an hour after you fed your baby in the morning, you may pump 1 ounce, 3 ounces. You may pump, depending on what kind of feed your baby's been doing in the last 24 hours. This will vary daily, but most likely you will get less milk the second day you do it. So just to warn you, it takes sometimes a couple of days for your body to respond. So not to panic. If you get 3 ounces the first day and then you pump again the next day and you've only got 1, it's not a problem. Just feed your baby when your baby's hungry and let your baby do the work. Your breast milk supply will increase. And it will increase. You'll have a slight oversupply when you go back to work. But I encourage you to only do this once a day because, again, this is your time with your baby, and it will be okay if you only do it once a day or if you skip a day here and there. So after you pump, then store the milk in the freezer and respond to your baby as your baby is hungry. So a few weeks, warning, do not excessively pump. We are really in the more is better mindset when it comes to breast milk. You may put yourself at risk for infections, for plugged ducts when you return to work. You may get hooked on the pump where you have to pump even if you're not working. So just to warn you, you don't need this much. If you do happen to have this much, I encourage you to donate it to the Mother's Milk Bank of San Jose or to your nearest Humana banking. So anyway, I just like to put that in there. It was very hard for me to grasp this concept when I was a resident. And all right, so another thing is learn hand expression of milk. When you go into delivery, I would like for every patient who leaves our hospital to know how to express milk by hand. And I'll give you, there's a really good video on the newborns.stanford.edu, but it can be a tool throughout your breastfeeding experience. It can be helpful as if you're trying to increase your milk supply at the beginning, as sometimes people are, to meet babies' needs, but also it can be a benefit if you're at work and you forgot your kit and you've got the pump but not the kit, or the kit and not the pump, and it can be useful to be able to know how to do this. Most people who are working full-time or even part-time are going to benefit from a breast pump, but just want to put that out there. This is something that you can do. And basically, the idea behind it is that you're putting pressure back towards the chest wall. It's not squeezing the nipple itself, and you're applying pressure backwards and behind the nipple, and that you'll see things spraying from all different directions. So you'll need something with a wide container. You won't be able to express into a very small container. So then this is in preparation, how much milk is your baby going to need? Babies typically will need about 1 to 1.5, there's a typo there, ounces per hour that you will be away. And so if you're gone for a typical 8 to 10 hour day, then your baby would at most need about 12 to 15 ounces per day of breast milk stored. And you can see here there's some storage guidelines, and I'd encourage you to look online. The Academy of Breastfeeding Medicine has a protocol on breast milk storage. But breast milk is so antimicrobial, it can stay in the refrigerator for up to a week even, and so just keep that in mind. It's a really good resource there. But what you might want to do is then you've been maybe freezing a little bit of milk, and instead, a week before you return to work, start refrigerating that excess supply, because the fresher the milk, the more it retains its properties. So frozen milk is fine and wonderful, and yet the fresh milk is even better. So you can store some up each day, and say you get pumping 2 or 3 ounces at that point, then you've got 20 ounces at the end of that week. That's more than you need to leave in the refrigerator when you go back to work. And so I'm going to talk a little bit about some lactation accommodation. Nationally, there is the Affordable Care Act that will cover breast pumps and breastfeeding services. It will also require employers to provide reasonable break time for non-exempt employees to express breast milk in a place other than a bathroom for up to 1 year after birth. So that covers people who are paid by the hour. It does not cover people who are salaried. So that's a big distinguishing fact. This has been a source of great difficulty, for example, for teachers across the country. We are fortunate here in California to have a different law, but this also allows for employers with fewer than 50 employees to claim an undue hardship. This is a great resource here, the Business Case for Breastfeeding, great resource online, as well as the U.S. Breastfeeding Committee has great resources for kind of toolkits and how to get the support you need at work. In California, we are very fortunate. California has been progressive in this field. It extends the benefit. It is not, this actually pre-existed the Affordable Care Act. Benefits to break time are extended to non-exempt and exempt employees. So that includes all employees. There's no upper age limit of the baby, and time for breaks. So for example, if someone does work hourly and they are allowed a 15-minute morning break and a 15-minute afternoon break, that time can be used towards pumping, but their clock for their break doesn't start until they get to the site of where they're going to express milk, because it's on the employer to really provide for that site. And so there's also in California something called paid family leave. We are fortunate again to be in one of the 2 states in this country who can benefit from being paid during time that is beyond their disability. So you get your disability time that is paid, and then in addition in California, you can have paid family leave instead of the FMLA, the Family Medical Leave Act, which does not pay but ensures job protection. So now you're back at work. So a few tips on that. Most of us are not as fortunate as this Italian member of parliament who you may have seen has taken her, this was a newborn, has continued to take her child to work with her, and now is a 2-year-old. But most of us aren't able to really carry our babies around at work. And so it can be helpful to plan your return to work midweek or part-time the first week, even if it means coming back a little bit earlier, and to make plans with your boss ahead of time. One of the first things you'll need to know is, where are you going to pump? And I encourage you to keep a really positive attitude with people. There are these requirements, and I talked about the laws that protect you, but also to try and make it as easy as possible for your boss and your coworkers, so that it can be a positive experience for everyone. Ask your HR or other pumping coworkers, where can we pump? And consider using covers. People have come a long ways. You saw that picture of my colleague at the beginning with that cover. You really couldn't tell what she was doing there, to give you privacy. And if you do that, you can really open up the opportunities to find places to pump. If you can get yourself set up so that you can be discreet in an option that may not otherwise be as private. Your car can be an option. Many like police officers and people who are doing sales and on the road, you want to have that battery adapter for your pump, and just encourage you to be creative. So the work pump repeat, the author gave me a picture of, I hope you'll find this a little bit funny, any place can be a lactation suite. This is obviously not the ideal, but this is something that, find a spot, find a place for yourself. And no one can prohibit you from pumping in a place because they are uncomfortable. You want to, if you're discreet and you're pumping anywhere, please talk to your HR. If you feel like people have asked you not to pump, that would not be okay. So how do you find time to pump? Most people will need to pump 2 to 3 times during an 8-hour workday. This varies dramatically. If you go back to work when your baby is 6 weeks old, you will need to pump more frequently than if you go back to work when your baby is 6 months old. Babies and breasts become more efficient, and there is also an idea of storage capacity. So some people can get by with pumping less frequently because their breasts can store a large amount of milk and express a large amount of milk in one pumping. Other people maybe get less and more normal amount of breast milk, and 2 to 3 ounces in a pumping, and they may need to make sure that they're vigilant about pumping frequently. You can't tell what someone's storage capacity is by looking at them. It doesn't relate to breast size. It's really It's multifactorial, but you can only predict it as you see it. Women pump with a hands-free bra. In general, the hands-free bra is an amazing invention. Women can do a lot of things. They can work at the computer, they can be on the phone, they can continue work, they can call into meetings. So there's a lot of creativity that people have found solutions with. And I do want to point out that with great caution, women do pump with a hands-free pump in the car. This can be, in our days of commutes, it can be a deal breaker for people. They can get the milk that they otherwise wouldn't have been able to. But I encourage people to use great caution, that to not have anything, to have it all set up before you drive, and to pull over, and if you need to make any adjustments or turn the pump off. So I want to encourage, I don't want to encourage anything that would be unsafe. Refrigerating, so your breast pump will come with a kit that you use to apply to the breast. And typically you would wash that kit every time, but that may not be necessary. There's special wipes you can use to wipe it off, but I've heard a lot of people using the same kit all day, and they put it in the refrigerator with their breast milk when they are done with that pumping, and they pull the kit out and pump just with new bottles or containers to drain into throughout the day. Now, some women are sensitive to cold, and that would not be a good option for them, but many women find this a great time saver. And so this is just a sample schedule, and I'll talk a little bit more about tips to maintain your supply when you are at work. It's very important to, especially in the early months, to maintain your supply if you are choosing to breastfeed for this first year, because babies will also sometimes opt out of feeding directly, and you will then be stuck with the pump if you don't maintain their supply. The babies are very smart. They'll get what's faster and easier, and so you want to maintain that supply so they'll continue to nurse. So a couple of tips here. If your baby is asleep and you're about to leave, there's a couple of options. You can dream feed, or you can feed your baby while your baby is sleeping. And some babies will just, you can top them off, and then they'll keep right on sleeping, and people love that. And that's if you're at home and if you're leaving your child at home. Some people don't have a lot of success with that, and that can wake the baby up, especially as baby gets older. So I'd encourage you to listen to your child care provider and do their preference. And if they prefer that you not top baby off right before you leave, sometimes a quick pumping at home and you leave some fresh milk can help, so that you don't have to pump immediately when you get to work. Feed the baby at daycare in the morning and evenings, and this can be a great time to connect with your baby's child care provider. If you get there, you're at daycare, you can have the baby breastfeed and get to know the people better, and it can enhance your relationship with your child care provider. And especially at the end of the day, as a mom, you're going to want to know every detail, every diaper change, every ounce, and it can be a great opportunity to connect. And it also is good for your milk supply. During your time off, breastfeed directly as much as possible to help prevent weaning from the breast. So even if you have an adequate milk supply, some babies will start to prefer the bottle over the breast, and that means you're getting up at night and pumping. And to avoid that, you want to try and optimize your baby wanting to breastfeed directly. Sometimes if you are on your way home, baby is getting hungry, if you can encourage your child care provider to contact you so that they can even give a pacifier. Now, I hesitate with the pacifiers, especially in the first few weeks, but this can be a nice thing. Use the pacifier or otherwise distract baby if you're only a half an hour away. If this can't happen and then they do feed the baby, then consider doing a final pumping at the end of the day at work, depending on what works out. Some women who, I've heard the term power pump be used quite a bit, and it's basically on the concept that your milk supply is affected more by the frequency with which you breastfeed than it is the duration. And so if you can pump, the power pumping is not for everyone, but if you can pump like every 30 minutes for 5 minutes, just a little bit, for a few hours, for a couple mornings, if you've had a dip in your supply, this can really enhance your milk supply. Not everyone can do that, but with some of these creative solutions where people walk around and are pumping and it's not interrupting their workday very much, then this is an option. And then use your hands when you're pumping. And this is something you can find on our Stanford Newborn website as well, a great hands-on pumping. You can often get quite a bit more out from the breast, and the more empty your breast is, the more your brain will trigger your breast to make more milk. And so that's the idea behind that. Other tips, it's great if you can sleep in close proximity to your baby. And what I mean by that, they have co-sleepers that safely set your baby not in your bed, but very nearby. There's a lot of options for safe close sleeping with your baby. When your baby is in close proximity to you, you will go through sleep cycles the same as the babies. And when you are in your deepest level of sleep, your baby will be also. And when your baby is in a lighter level of sleep and getting close and ready to feed, you will also be in a lighter level of sleep. And the reason this can be so important to know is that by sleeping close to your baby, you will be tired as you go back to work, and this is one thing that can be instrumental in helping to decrease your fatigue, is not waking up when you're in your deepest phase of sleep to a very unhappy baby. So if you're together, then you can work together on that. And I want to point out the importance of safe sleep, and not to move this operation to a couch or a sofa when you are at risk of falling asleep. Those can be very dangerous places to feed your baby, and so to encourage you to have a safe place to do that. Teach your child care provider about the paced bottle feeding that we talked about earlier, and to use your freezer stash for the spilt milk, or for the milk that got left out, or the bottle that didn't get finished. And you've got this great freezer supply, because most of you will do that, but to try really and limit the amount of supplementation your baby gets from that freezer supply. Because, for example, if your child care provider takes 3 ounces out of the freezer, thaws it, and feeds it to your baby, then that will be 3 less ounces that your body is being triggered to make. And so you will come home and your baby might not be as hungry as your baby otherwise should be in order for this to work. When it's time for solids, it's very exciting. You've been breastfeeding, and it's very exciting when your baby is ready for solids. And I just want to encourage you to let someone else enjoy that, and let your spouse or your child care provider enjoy that fun introduction to solids. And for you, when you're around, to continue to offer the breast first and then the solids. And your baby, if you're working full time, will have plenty of time to get all the solids it needs. And this will help to maintain your breast milk supply during the second half of the year. Send bottles with smaller quantities of milk. A lot of childcare providers are more familiar with formula amounts, and formula-fed babies often will take larger amounts in quicker amounts of time. So just to remind your child care provider that most babies are not taking large volumes at the breast, and we want to mimic that as much as possible. When they're very young, it can be 2 to 3 ounces, but it won't usually get beyond 4 ounces, even for your older baby. The amount of breast milk that your baby takes in at 3 months doesn't really increase over the year, and so your baby just becomes more efficient. And so just to keep that in mind, if you see that your baby's taking in a lot more volume at work, when you're at work, that there may be some things you can do to address that issue, that your baby shouldn't be needing to take increasing volumes after that point. And don't do anything don't do anything at home that someone else can do. And I had kind of a funny story with my I had the 8-year-old, the 5-year-old, and the baby. And the 5-year-old was over at a friend's house for dinner, and they were talking about what moms and dads do at home. And they were asking Mary questions. Well, who cooks at your house? Oh, my dad does that. Who does this? Who does that? Who does the? And my dad. They're like, well, what does your mom do at home? Well, she makes milk, and that made sense to my baby, and I'm very grateful that I can tell that story. That was instrumental in my being able to make milk, was that I didn't have other childcare, other responsibilities at home during that first 6 months especially, but even throughout that first year. So if you come home and your baby took an extra bottle at daycare, then you might want to consider adding a pumping session at home in the evening, especially if your child is sleeping more than 5 to 6 hours at night. You might want to pump right before bed. This is going to be the time of day where you'll often have the lowest volume of milk, but you can trigger your body to make more milk. Many babies will cluster feed in the evening. You may come home and your baby may feed for what seems like the entire evening. And as long as your baby is satisfied, that's actually great for your milk supply. And just keep in communication with your child care provider. Taking in fluids, I encourage you all to eat regularly, but really taking in fluids is more important for your milk supply than what you may be eating. And be aware that there are certain medications that can inhibit your milk supply. Common ones are decongestants and combined birth control pills. But LactMed is, if you Google LactMed, you can find a very good respected website that will lead you to look into medications. If you do notice a big drop in your milk supply, also check your pump and your parts. The single-user pumps, I think, most of them have a warranty of 12 months. If you are heavily pumping, like I was in residency, at 6 months, that pump gave out. So depending on how much you use that pump, it's not obvious by the way it feels. You may feel like it's even hurting, like it's even pumping harder. So to really get your pump checked out, and if indeed it's not working adequately, to get it replaced, try a hospital-grade pump for a few weeks and see if that makes a big difference. That can be a signal to you that this is really pump-related if you see a dip in your milk supply. And be good to yourself, take care of yourself, and here's a couple of pictures here. It's okay to cry over spilt milk. If it gets on your keyboard, just tell them it was coffee. This can make you cry. These drops of milk that you get can be very precious to you. And then I want to talk a little bit about optimizing your experience with coworkers and your boss. Some people find it helpful to have a written plan. Not everyone needs that. Be creative, take this on as your own cause, and find the people who will support you. And you will remember them forever. There will be people in all of your work sites who will support you, and it's a wonderful relationship you form with them. They will always be grateful. You will always be grateful to them for the support they offer. Educate your coworkers. Let them know this is not a lifestyle decision. This is a medical decision. This is a health decision that you're making. So don't apologize. You don't apologize for going to the restroom. You don't want to apologize for doing something for your baby. You can thank them for helping you, but resist the urge to be apologetic. Place the milk in an opaque bag in the refrigerator. Your milk, per CDC guidelines, is allowed in your staff refrigerator. It is not considered a bodily fluid such as urine or other bodily fluids that would not otherwise be allowed. Your breast milk is allowed, and it is considered food. But some people will be uncomfortable with it, so I encourage you to not make it as obvious to people so that you don't have to have those confrontations and conversations. And be as flexible as you can. Find a way to pump during the meeting. People can put pillows over their breast pump to make it, if you're on a conference call, to make it sound lower volume if you don't want to necessarily bring this into the discussion that you're having at the conference call. There's a lot of creative ways to handle it, and make sure that you're pulling your own weight, and people will appreciate that. be sensitive to your coworkers. Some of your coworkers you may not know as well. You know the people that you can talk to about your baby, pumping, breastfeeding, and all the things that you're going through. But be sensitive to the fact that one of your coworkers may have just miscarried, or another coworker may have tried to breastfeed and it didn't work out at all for her. These issues can become big at work, and so to minimize the distraction that it may cause, and to extend gratitude to people who will make it work with you. The womenshealth.gov has a great website, and that's where I got this picture. So I'm going to briefly touch on travel. Some people will be traveling for work, and I don't have as much to say about this. The book Work, Pump, Repeat is amazing. With this woman, she traveled halfway across the world and figured out how to make it work in airports who don't have our accommodations, and really she's got great information on how to handle a business trip where you're away from your baby. But I did want to just point out in general that you are allowed to bring breast milk past security. They're allowed to ask you to open it. They're not allowed to ask you to do anything else with it, and they can't do anything to your breast milk. Look for pump rooms in the airport in California. There's a law that pump space be provided for women beyond security. And that's something that if you're getting on an airplane, you want to be as empty as possible before you get on the airplane. But on longer flights, you're going to need to look at either pumping at your seat or pumping in the bathroom. Those are pretty much your two options. And so to consider, if you have the luxury of flying first class, which many of us don't, but that can be where you can find electric outlets, and to make sure you have options for battery adapters, because you will, and something to cover you if you're more comfortable with that when you travel by air. Hotels, even if they don't have refrigerators in the rooms, most of them have like the mini bars when you're traveling. You can ask them for an empty refrigerator, and even for freezing options when you visit hotels, and they're generally very happy to accommodate that. I've heard great experiences with people having their milk frozen. Some companies will even put dry ice and ship your milk home for you. So there's a lot of different creative solutions that people have come up with in this world that has become much smaller with our ability to travel. So here's a few funny slides. Dude, that's not creamer. So your milk may be picked up at some point, and to have a sense of humor about it is always helpful. Nothing says I'm a pro like spilling your breast pump parts all over the lobby. You're trying to be discreet, but you're carrying a big load here. There's a lot. This certainly is something that may occur. Trying to wash your pump parts in the sink is going to result in a "what you got there, Elizabeth?" So people are going to be curious, and they're going to want to know what you're doing, and to treat it with a sense of humor, I think, is always helpful. He shoots, he scores. Now, this I have not seen in real life. I've seen all the other scenarios, but way to close the deal, team. What's that in your hand, Cynthia? So just to be aware that there are a lot of people in your workplace who will not necessarily be familiar with all this, and to take the opportunity, and they will become familiar and support you. Weaning, I just want to say a word about weaning. As your baby takes in solid food, the weaning process begins, and then we want that to continue gradually over the next 6 months or a year, or as long as you'd like. And you will listen to your body when it comes to how to gradually decrease if you're pumping 3 times a day, you don't want to stop. You want to drop one of the pumping sessions. And you can sense how you feel. If your breasts feel very full, you want to be careful. You still can get mastitis and plugged ducts even at this point. So just to be cautious. And most women will not need to continue pumping during a usual workday after their baby turns about a year. This can come earlier or later for some people. My oldest was allergic to, had an undiagnosed milk allergy and didn't somehow take to any dairy I kept trying to give her. So I pumped longer for her. She needed the breast milk during the day. Other kids didn't need that, and certainly you will be able to follow your baby's guidance with that. And then I'm just gonna leave this. These are two of my 3 children now. I'm there in the middle, and just to reassure you that breast milk will not turn your baby's hair blue. So, all right, thank you very much.